The big mistake most people make at night. Most people take a PM pill right at lights out without checking what's inside. The label promises sleep, so it feels harmless. But the sleepy ingredient in many PM products is a first-generation antihistamine with strong anticholinergic effects. That matters at night because your body needs to dip blood pressure, keep heart rhythm steady, and maintain oxygen. When you add a sedating anticholinergic at bedtime, you can disrupt all three. Here's the thing most people miss. During healthy sleep, your nervous system shifts toward rest and repair. Blood pressure typically drops 10 to 20%, heart rate variability increases, and breathing stabilizes. Sedating antihistamines slow brain activity, but they also blunt the cholinergic system that helps fine-tune blood pressure regulation and airway tone. The result can be less dipping, choppier rhythm control, and more fragmented sleep, so you wake groggy and less steady on your feet. Now, here's where many folks get a double hit. A lot of nighttime, cold, and flu products sneak in a decongestant, pseudoephedrine or phenylephrine. Those constrict blood vessels and raise blood pressure. So, you might be taking a sedative that dulls your protective reflexes, while a decongestant pushes your pressure up. That mismatch is a bad fit for bedtime, especially if you already treat hypertension or have sleep apnea risk. Pain plus sleep combos quietly stack risk too. The pain reliever is often plain acetaminophen, which is fine on its own when used correctly. But the PM add-on is the anticholinergic. Layer that with a nightcap or dehydration, and you multiply dizziness, morning confusion, and fall risk. I've seen people wake at 3 a.m., stumble to the bathroom, and nearly pass out, not from the pain med, but from the sedative anticholinergic effect, plus low fluids. Another overlooked problem is hidden duplicates. You might take an allergy pill with the same sedative, then a PM pain reliever, and maybe a nighttime cough syrup, all sharing diphenhydramine or doxylamine. Or you double up acetaminophen across products and exceed safe daily limits without realizing it. That's how people end up with liver risk from acetaminophen and anticholinergic side effects at the same time. If you remember nothing else, remember this. Bedtime is when your body should be coasting, not wrestling with mixed drug signals. Read the active ingredients. If it says diphenhydramine or doxylamine, or if the box lists sinus, congestion, or maximum strength, it's a red flag for night. There's a smarter way to manage pain and congestion without sabotaging your heart rhythm and oxygen while you sleep. Now, here's the specific pill most people never suspect. The culprit, nighttime antihistamines, diphenhydramine, doxylamine. When a box says PM, the drowsy effect usually comes from one of two first-generation antihistamines, diphenhydramine or doxylamine. They were designed for allergies decades ago, but they cross into the brain and strongly block acetylcholine. That's why they make you sleepy. The problem is that the same anticholinergic action also slows reflexes, blurs thinking, dries you out, and interferes with the nervous system that keeps blood pressure and heart rhythm steady overnight. Let me make the stakes clear. Older adults are more sensitive to anticholinergics because the brain has less acetylcholine reserve. The liver and kidneys clear drugs more slowly, and there's often a longer list of other medications on board. That's why the American Geriatric Society's Beers criteria flags first-generation antihistamines as avoid in older adults except for severe allergic reactions. Note, when mentioning decades elsewhere, use the correct format, e.g. 1940s and 1960s. No apostrophe, no truncated digits. It's not about being anti-sleep. It's about risk stacking when your body is supposed to be in its most stable state. What exactly do these drugs do at night? First, they impair baroreflex sensitivity, the tiny moment-to-moment adjustments your body makes to keep blood pressure smooth. You want a clean dip in pressure during deep sleep. Anticholinergics can flatten heart rate variability and blunt that fine control. So pressure may sag unexpectedly when you stand, surge in light sleep, or fail to dip properly. Any of those patterns raises cardiovascular strain and makes morning dizziness or bathroom trip near falls more likely. Second, they dry mucous membranes and relax smooth muscle in the upper airway. If you snore or have undiagnosed sleep apnea, that dryness and relaxation can worsen partial collapse of the airway. That means more oxygen drops, more sleep fragmentation, and more adrenaline surges to reopen the airway. Those surges are exactly what you don't want if you're trying to keep blood pressure, rhythm, and clot risk calm through the night. Third, they can unmask rhythm problems. The combination of reduced vagal tone, altered heart rate variability, and sleep-disordered breathing is a classic setup for atrial irritability. People describe waking with pounding, fluttering, or a skipping sensation after a PM night. Even if the episode passes, those bursts matter. Atrial fibrillation can start and stop in short runs and still allow clots to form. That's the stroke connection most people never hear about. Now let's connect this to everyday products. Diphenhydramine shows up as the main ingredient in Benadryl for allergies, ZzzQuil for sleep, and a long list of PM pain relievers like Tylenol PM and Advil PM. Doxylamine appears in some Unisom products and other nighttime formulas. The labels don't shout anticholinergic. They just promise nighttime relief or non-habit forming. For someone over 60, the habit you'll want to form is reading the active ingredients panel before bedtime. The other big issue is cognitive effects. In older adults, anticholinergics raise the risk of acute confusion, memory slips, daytime sedation, and slower reaction times. That means next morning balance problems, bathroom urgency without control, and trouble focusing. If you already take medications for bladder symptoms, anxiety, depression, IBS, or allergies, your total anticholinergic load might be high without you realizing it. The nighttime pill can be the straw that tips you into delirium or a fall. Here's a quick mental model to keep this simple. Think ABC: autonomic control, breathing stability, and cognition. Anticholinergics nudge all three in the wrong direction at night. Autonomic control, blunted baroreflex, and heart rate variability. Breathing stability, drier, laxer airway with more snoring and drops. Cognition, morning fog, confusion, slower reflexes. If one of those is already fragile for you, a PM antihistamine can turn a small problem into a dangerous one. A common pushback is, I've used it for years and I'm fine. Two thoughts. First, risk isn't a guarantee, it's probability. As we age, the margin for error narrows, and last year's fine can become this year's tumble or ER visit. Second, sleep that depends on anticholinergics isn't deep, restorative sleep. Many people feel groggy and unsteady, not refreshed. When they switch to safer routines and timing, they sleep fewer total minutes at first, but feel better and steadier by morning. So what should you do with allergies or a cold flare at night? Use daytime, second-generation antihistamines that don't have anticholinergic brain effects, and keep nighttime focused on non-drug congestion care. For sleep, build a routine that anchors your circadian rhythm instead of overriding it with sedation. And if you absolutely need a short-term sleep aid, talk with your clinician about options that don't carry a heavy anticholinergic load. One last naming trap to avoid. Brand families reuse names across different formulas. Unisom, for example, sells doxylamine tablets, but also melatonin blends. ZzzQuil has diphenhydramine liquids and melatonin gummies. The name doesn't tell you the ingredient. The active ingredient line does. Make that your rule every night, because here's the payoff. When you remove diphenhydramine and doxylamine from the bedtime mix, you protect your brain, your blood pressure pattern, and your heart rhythm while you sleep. But antihistamines aren't the only culprits after dark. Some nighttime cold combos quietly add a second risk that pushes pressure up when you're least aware. That's where many people get caught next. Hidden danger in cold and flu nighttime combos, pseudoephedrine/phenylephrine. Here's the twist most labels don't make obvious. Some nighttime cold and flu products blend a sedating antihistamine with a decongestant. The sedative tries to slow you down. The decongestant tightens blood vessels and nudges blood pressure up. That's a mixed message for your heart at the exact time your body should be easing into a low-pressure, steady rhythm night. Let me break down the decongestants. Pseudoephedrine is the classic oral decongestant. It's a vasoconstrictor, which means it squeezes blood vessels in your nose to reduce swelling, but it can also raise systemic blood pressure and heart rate. Phenylephrine is another one you'll see on boxes. It's less reliably effective for congestion, but it still has vasoconstrictor properties. Either way, the effect is stimulation, not relaxation. And that's a poor fit for bedtime if you're over 60 or you treat hypertension. Now think about the normal dipping pattern your blood pressure follows at night. You want a 10% to 20% drop. Decongestants can blunt or even reverse that dip. Add a sedating antihistamine that dulls your body's protective reflexes, and you've got higher pressure with slower reactions. That combo increases chances of nighttime surges, morning spikes, and rhythm irritability. If you also snore or have undiagnosed sleep apnea, those pressure swings stack with oxygen drops, exactly the environment that pushes stroke risk higher. Interactions make this trickier. If you're on beta blockers, ACE inhibitors, ARBs, calcium channel blockers, or diuretics, a decongestant can compete with your meds. It can also worsen urinary retention if you take prostate medications like tamsulosin or finasteride. And if you already use other stimulants, caffeine late in the day, some antidepressants, or certain migraine medicines, you can feel jittery, wired, or notice palpitations when you lie down. That's not just uncomfortable, it's a warning sign. Labels to watch are the ones that shout relief but whisper the ingredients. Words like sinus, congestion, maximum strength, and day/night packs are tip-offs. The day pack often contains a decongestant. Sometimes the night pack does too. Don't assume the moon and stars on the box mean it's pressure safe. Flip it over and read the active ingredient line. If you see pseudoephedrine or phenylephrine anywhere in the nighttime side, set it back. A lot of people ask, but I can't breathe at night. What am I supposed to do? Here's the shortcut nobody teaches on the box. Handle congestion locally, not systemically. Saline nasal spray or rinses shrink swelling by flushing mucus and allergens without touching your blood pressure. A cool mist humidifier keeps airways moist. A medically guided nasal steroid by day builds baseline control in allergy seasons. A menthol rub on the chest can give that open feeling without forcing your heart to work harder. Another move that helps fast: head elevation. 2 pillows can kink your neck and actually worsen airway collapse. Instead, raise the head of the bed by 4 to 6 inches or use a wedge pillow. That angle reduces nasal pooling and postnasal drip, so you're not mouth breathing all night. Combine that with a short, warm shower or steam inhalation 60 to 90 minutes before bed to loosen secretions. You'll get better airflow without the vascular squeeze. If cough is keeping you up, reach for non-stimulating options. Plain honey in warm water can soothe an irritated throat. For a dry cough, dextromethorphan can be considered, but avoid combo syrups that sneak in decongestants or sedating antihistamines. If reflux is part of your cough, finish dinner earlier, avoid late alcohol, and don't lie flat right after eating. That's often the real fix behind a mystery cough at midnight. One more hidden trap: brand families change ingredients by flavor, form, or season. The severe sinus nighttime gel cap might include phenylephrine while the liquid version drops it. The only way to know is the active ingredient panel. Make it a habit to scan for diphenhydramine, doxylamine, pseudoephedrine, and phenylephrine. If any show up on the nighttime side, you've found the risk stack. I want to be clear, relief matters. You deserve a night where you can breathe and sleep. The reason I'm tough on these combos is that the short-term comfort can carry a hidden cardiovascular price, especially after 60. Systems that use to adapt easily don't have the same buffer. So shift the timing. If you truly need an oral decongestant, talk with your pharmacist and take it in the morning or early afternoon, not within 8 hours of bed. Do this tonight. Choose plain formulas. For pain, plain acetaminophen. For congestion, saline and humidity. For sleep, anchors and wind down cues. When you stop mixing a sedative with a blood pressure raiser after dark, your heart, vessels, and brain get the quiet night they're designed for. And that's the foundation for a safer, clearer morning. The arrhythmia link, atrial fibrillation, and stroke while you sleep. Nighttime is prime time for rhythm instability because your autonomic balance shifts and breathing patterns change. As you drift into deeper stages, vagal tone rises and blood pressure dips. That's normal. But if you layer sedating antihistamines, a decongestant earlier, or a nightcap, you can push the system toward irritability. The atria, the heart's top chambers, get twitchy. That's where atrial fibrillation tends to flare, often in brief, unnoticed bursts while you sleep. Here's the shortcut nobody teaches. AFib doesn't have to last long to matter. Even short, self-terminating runs can. Let blood swirl in the atria instead of flowing smoothly. Stasis promotes tiny clots, especially in the left atrial appendage. If a clot breaks loose and travels to the brain, stroke risk can shoot up within minutes to hours. That's why I woke up with a weird flutter story deserves attention, not a shrug.